Hello, my name is Marilu, or Alotte in my YouTube channel, and I am a physical therapist. So today I'm going to show you some exercises for scoliosis, specifically dextroscoliosis. So mind you that it's not going to be applicable when you have levo scoliosis. Okay, I'm trying to help my friend who has a child that has this condition. So I already made the exercises for her. I'm just going to show you how am I going to do it. Okay, I'll start with the ball exercises. I'm gonna use the peanut ball at first. It's really hard to because it's really hard if you use the the old gym ball like right away. So I'm just gonna use this. Okay, I am gonna start with the stretching. So since this is like dextroscoliosis, so the bulk of the curvature is going towards the right on the upper body, and then the lower body is more towards the left. It's an S curve to the back, so it's an S curve, but it's the other way of the letter S, if you know what I mean. Okay, so I'm gonna stretch the part in here, which is the compressed side, by lying on this side. Okay, so you could either bend your knee in here for you to balance it first, and then you just have to stretch it out. Now in dextroscoliosis, the left part is always compressed and the right side is always stretched out. So you could hold this for about 10 seconds if you want, and for 10 times, and you could just proceed. You're just going to add on more holding as you keep on doing it. So after this one, if you're used to with these exercises, then you could straighten out your leg and then stretch it out still. Okay, so the second one that I'm going to show you is the bird dog exercises. So you only have to do it like on one side. I forgot to tell you, if you're doing exercises for scoliosis, you are only going to do it specifically to one side, depending on what type of scoliosis you're having. So with the bird dog, not beard, bird dog, since this is the one that's higher shoulder and it goes towards that side, so you're gonna put that down right here, or on the back, and then you stretch this one out, and then opposite, because this is the part that is compressed and this is the part that's like stretched out. Okay, one, or you could just do bed to hold it for a little bit when you're starting. Then you can hold for 10 seconds, you elongate, you stretch this part, and you stretch this part on the lower back, right there. Okay. Alright, so the third one that I'm going to show you is pretty much more like the Superman exercises. Okay, I am going to put my feet, and this may be really too low for me because this is a different kind. We could always progress it with the gym ball, which is rounded one, but because I need her to exercise, and she's still a minor anyways, so I'm gonna put my feet against the wall, and then I'm just gonna do these exercises. There, one. You could start with no holding, or you could start with holding. This is to strengthen the muscles on the upper back and also the neck part. So apparently, with my friend's daughter, she is also having a little bit of kyphosis, so I need that corrected too. You could start with this one, and then you can hold it as well. Usually start with 10 seconds hold, 10 seconds. To stretch the upper back, it's just a little bit easier. Either you start with just like this for balance, and then you progress it later on with the legs straight. Okay, so this is still to stretch the upper back and also the neck part. Of course, you don't have to stay this for like minutes and minutes. Okay, you could hold on for a little bit. You might actually get these. And then you hold it again for 10 seconds. And then back. Okay. The next one that I am going to show you is the standing exercises. So I'll start with just stretching the pectorals, which you can already see in some of my videos. But this is just to stretch this part in here and also for the neck. So I'm just gonna do it like this first. Push your body forward, and you should feel that stretch right in here. Okay, you start with that. You can look up at the same time. So you stretch here on the pectorals, and you also stretch a little bit more on the neck. After that, you do V side, and you still have to stretch this one too. You should feel a stretch. If not, then you're not doing it like properly. Perfect. Now the next one is very specific. So put your feet a little bit like 6 inches away from the wall, and then put your arms a little bit like 90 degrees against the wall with your right side only. Okay, because remember, this is dextroscoliosis. Push your pelvis against the wall. This is pretty much like to realign the spine. This is just like realigning the spine, but I want to add on with extension. Okay, so with extension like this, probably just more on the upper back. Do not go all the way down, because your fulcrum will be in the lower back. It's gonna be painful on the back. So just do it like this, and then with head extension. Hold it if you can. If not, then just do repetition to start it. Okay. I'm gonna do 2 seated exercises. So I'm gonna do exercises to stretch only this side, the left side. Okay, because she's also doing like this. So I'm gonna hold my arm right in here. I am going to bend my neck to the left, no, to the right. Turn my head to the left. Sorry. Hold my right arm under the chair, and then I'm gonna pull my head back. It's slightly angled about 45 degrees, and I should feel that stretch right in here. Okay, so this is stretching the sternocleidomastoid muscle, which is responsible for muscles with conditions like torticollis. Okay. And then you could do one lateral. This one is supposed to counter pull the pulling. That way you should feel that stretch. Okay. Next is, I'm going to pull my hand at the back of the neck like this. And then I'll just have to bend it just on this side. Stretch this part. You compress this part. Hold it. Okay. This one is you stretch this one here. The thoracic part is being like stretch out. And then you bend it to where the curvature is. Okay. And then the last one I'm going to show you is up in the bed. I'm going to do the stretching. This time it's on the lower part of the spine. So I only have to go towards the curvature. So I'm going to go this side only. because this is stretching the lower part of your spine. You can hold it back to the center, and then you hold it. You might as well just do it like on the floor. I'm just up here in the bed. Do not do it on the other side, just on this side, towards the left. Okay. Now when you're sleeping at night, you might want to do pillow, or you might want to do rolled towel. Then you sleep like this. Or there should be another pillow in here just in case. But this one is to push your thoracic, your upper body, towards the midline. Then you could also put pillow in between here. Okay. That one you could just stay for as long as you want. Make sure that when you put another pillow here, that should be, you should not put your neck like this or two like that, but just more on the midline. Putting the pillow under here would also make your pelvis in a neutral position. So forearm flat on the bed, and then I just want you to push up, but keep the forearm straight. Now because this is a dextroscoliosis, you're just gonna push this side all the way in. Again, push up straight with the head up, and then I'm gonna push this arm all the way. Okay. This, like I said, this is only for dextroscoliosis. So another thing is I'm gonna push this in here to the left, legs to the left, and then the arms too, and head to the other side. This is like the opposite way of the rotation for dextroscoliosis. Hold it for 10 seconds if you want. Midline, and then you do it again. So that's all I need to, but mind you that this is only for dextroscoliosis. Do not do it when you have the opposite direction of the curves. Okay.